ANC's business wing, the Progressive Business Forum, is pushing for members who help fund the party to secure a cut of the contracts from the vaccine supply chain. Now, the forum met the ANC's top leaders, including President Cyril Ramaphosa, 2 weeks ago to lobby for a cut of contracts for the logistics that will get the vaccines into people's hands. Now, joining us now to discuss this matter further is Kganki Matabane, Black Business Council Chief Executive Officer. A very good morning to you. Thank you so much for your time. This is a very important matter, a pressing one, quite sensitive, especially as we look at the economic atmosphere and the manner in which business is performing during the COVID-19 pandemic. I know that just last month, President Cyril Ramaphosa had really just sent out a bit of caution, saying that during the COVID-19 vaccine rollout program, the business opportunities will not be many. I understand you've met him since then. What was the outcome of that conversation, and how does it move the business sector forward?
Morning, Paul, and the viewers. I think the issue that we raised was basically a principal issue to say we are very much aware that this is a very unfortunate situation of COVID. But just like during the PPE procurement, there will be business opportunities. And what we're calling for is that those business opportunities should not be limited to the monopolies of this world, of this country. They must be distributed equally amongst all the business people in South Africa. And we must follow our laws. You'll recall we do have public procurement laws in this country in the form of PPPFA. And we do have a broad-based Black Economic Empowerment Act. So we're just calling for, and proactively so, before the process starts, we're just calling for the government, government to implement the laws that we have accordingly. Because, for example, the regulations of the PPPFA, which is a Preferential Procurement Policy Framework Act, says anyone who gets a state tender of more than 30 million must subcontract 30% of it to small businesses. So we were calling for those to be implemented so that our Black business people in South Africa can benefit and play a meaningful role in the process.
Now, as you speak about these really important issues, warning against having a monopoly of a vaccine rollout and the dangers of that, what do you anticipate then in the value chain, business opportunities in terms of the different sectors and how business can benefit?
Yeah, there are various opportunities there. The first one, for example, is the manufacturing. We all know that the manufacturing is not done in the country. The procurement of that is done through governments. So we're not expecting anything from there. But there are other opportunities like logistics, storage. When the vaccine comes into South Africa, it needs to be stored somewhere. It needs to be transported from one place to the other. It has to reach the rural areas, far-flung areas. It has to be stored. So then there will be other opportunities like point of care centers where people are going to actually be vaccinated. There's going to be vaccination administration, people who controls and make sure that things are done properly. There are going to be IT systems that need to report back to government and gather information so that people can know how many people have been vaccinated and where, age, gender, and so on. We've got legal people who have to check whether we're complying with the legislation. There's communications. We need to get people to rally around and wish to participate in this process. So there are various opportunities that are available, and as you can see, they are not only for big business. They are for big business, small business, wide business, business owned by young people, business owned by women, and business owned by people with disabilities. So there are various opportunities that are there, and we're saying let those opportunities be open to all. Let them not be monopolized, as we've seen during PPEs, and also let those opportunities be given to companies that are properly registered. Companies that are registered with SAPRA must be given an opportunity, which is South African Health Products Regulatory Authority. Let's not get companies that get registered the day before a tender is awarded, and then they don't qualify, they don't comply with the regulations. If they comply, it's fine, but let's get companies that are compliant, so that we avoid what actually happened in the past.
Speaking about what actually happened in the past, we do know that around 7.5 billion rand was lost to irregular spending when it comes to the PPE processes. What are your thoughts on the SIU report?
Yeah, it's important that SIU is seen to be taking action. So we support the actions that have been taken. But I think it has to be taken further, so that actions are taken against those people who are involved. Those who are found to be guilty have to actually be dealt with according to the law. And we are trying to avoid this situation now. That's why we said, let's be proactive. Let's then upfront speak to government, because unlike the previous event, the previous processes, government is going to be the sole procurer, and business is not going to procure anything. Government is going to procure for the entire country. So we're saying National Treasury, Department of Health, please follow the laws as we have them. For example, we have triple PFA, as I indicated. We're not happy with it. As Black business, we've been calling for it to be scrapped. But that's the only legislation that we have now. So that has to be implemented to the fullest.
Thank you so much for your time and sharing your views, Kganki Matabane, Chief Executive Officer at the Black Business Council. We're going to have to leave it there for now. Weighing in, of course, on the COVID-19 vaccination rollout and distribution phase and the opportunities that are available for business.